everybody has to accept. All right, so this meeting is being recorded, and I'd like to welcome everyone for the information session that we conduct every Thursdays. And this is an information session that would cover NCLEX, OSCE, or both. So welcome to the information session of Nursing Education and Training Australia. I would like to start by acknowledging the traditional owners and the custodians of the land where I work and live, and that is Australia. And I'd like to pay respect to their past, to the elders past, present, and emerging. So welcome everyone to this information session. We are from Nursing Education and Training Australia, and we do provide the preparation course for the outcome-based assessment, which is NCLEX and OSCE. We work across the country and also halfway across the globe. Our simulation laboratories are located in Sydney, Melbourne, Brisbane, Sunshine Coast, and Adelaide. And our main offices are in Sydney, Melbourne, and Wagga Wagga, which is Wagga Wagga is a country town in New South Wales in Australia. So our vision is to be the preferred organization for the outcome-based assessment of internationally qualified nurses. This vision will change probably in the next couple of weeks, because this has been achieved already and we need to move forward. And as NETA keeps moving forward, we have to keep changing our vision as well. We aim that all of our candidates will pass the test. This is the Neta Values, and these are the Neta Values, and we do acknowledge that everyone has their previous knowledge as a registered nurse in their home country. We do support our students, so as our staff, and we pay respect to everybody. We do respect that everyone has a unique background, and that we also accommodate everyone. And we know that it is a multicultural country here as well in Australia. We work in teams, and of course, we do provide transparency. All that you can see and hear about us is they are all true, and you can get whatever you see from us. So as I said, we do provide the NCLEX preparatory course, but today we'll be focusing more on OSCE. And if you can see the background, my background, this is actually our step-by-step of the NCLEX program. I will concentrate more in OSCE because this is the main topic for today. And OSCE is an objective structured clinical examination. This is delivered by the by the Nursing and Midwifery Board of Australia, which is a member of APRA, the Australian Health Practitioner Regulation Agency, and this examination is delivered in Adelaide. This is a practical component of the outcome-based assessment. The theoretical component is NCLEX, and the practical component is what you call the OSCE. So these are the following skills to be assessed. And for our session for today, we will be talking about medication safety. And that would include the calculating of the drug doses, subcutaneous intramuscular injections, medication administration. With our injections, we do have safe disposal of sharps, and also the patient identification, and that also will cover risk management, because there are a lot of risk management that we do when we prepare medications. So for today's topic, this is quite broad. We will be tackling 1, 2, 3, 4, 5, 6 of the skills that is being addressed and that is being listed here by the NMBA, or the National Nursing and Midwifery Board of Australia. These are the resources as well that the NMBA has listed in their handbook, and fortunately, majority of these resources that are not in the internet, we do have it in our library. So if you would like to have these resources, please contact our library, and this is available to all our NCLEX and OSCE students. So today we will be tackling, as part of a resource, which is resource 1, the Australian Commission on Safety and Quality in Healthcare, which talks about the national standards. Medication safety is standard 4, which is a part of the 8 standards. So again, the 8 standards is quite broad, and standard 4 as well is broad in itself, and we'll be discussing the concepts about it. Then we do have the Australian Medicines Handbook. This is something that you have to purchase. The Australian Medicines Handbook is actually about $260, and this is something that is available to our students. So if you are a student of NETA, you don't have to spend 260 Australian dollars. You can borrow this in the library. Rest assured, when you finish your OSCE and become a registered nurse, you do not need this. This is something that is readily available in the clinical areas. And the other one that we will be tackling, or we will be using, is resource number 8, which is the therapeutic guidelines. So the therapeutic guidelines will talk about the safety management of medications. So we are talking about medication safety today. So we are also referring this to the therapeutic guidelines. Of course, as a registered nurse, you are expected to perform in accordance with the standards, which is also an information session, by the way, that we did last week. So if you missed that information session, please feel free to go to our YouTube page, and we have posted the video on the professional standards there. What is expected of you as a registered nurse in Australia, and how are you going to be assessed in your OSCE? So for today's topic, which is medication safety, for the information of everyone who has just joined in, we will be tackling the 6 skills that APRA has emphasized in your handbook, and this one I think can be found in page 10 of the handbook, if I'm not mistaken. So 6 skills: calculating drug dosages, subcutaneous intramuscular injections, safe disposal of sharps, medication administration, patient identification, and risk management in the clinical environment. To those who have just joined in, we will be also utilizing 3 different resources that the NMBA has specified in the handbook, and that is resource 1, the ACSQHC resource, which is the national standards. And if you missed this demo class, you are invited to go to our YouTube page to look at this national standards, which is number 1 in your resource. And also we will be using the resource of the Australian Medicines Handbook. I have told everyone earlier that this is available in our library in NETA, both in Sydney and in Melbourne. You don't have to spend $260 to get this book. You can actually borrow this book from us. And also resource number 8, which is the therapeutic guidelines, which would discuss or talk about the safety, use, and management of medicines. All right, so let's talk about the objective of this session. So at the end of the session, we are expecting that students will be informed of the different concepts in medication safety, which is essential for your OSCE. We do not expect you to know the details of it because, as I said, it's quite broad, and a 1-hour session will not be enough to tackle all of these concepts. But at least you know that it is there, and this is a thing that we will be discussing in your classes in OSCE. So if you haven't enrolled with us, you can contact our office if you would like to enroll to be able to know more details of the sessions and the skills and the resources that the NMBA has indicated in the handbook. So the first thing is asking the why it is very important for us to know these concepts on medication safety. So as we said, Medication safety is part of the national standards. When we say national standards, national itself means that it is practiced across Australia. So in your OSCE, you will be assessed according to these standards. It is very important because it is expected of you as a registered nurse, and all healthcare practitioners in Australia should know the standards. So, the very first reason why you need to know is because it is part of your OSCE. So, our main goal here is for you to pass OSCE, and that is the reason why you really have to know the reason behind the medication safety standards. Another reason is because 90% of the patients actually has some relationship with medication and the patient itself, whether it is a near miss or whether it is a medication error or whether it is an adverse effect or whether it is a mild effect. But there has been a relationship between a medication and the patient itself. And it is very important for you to know, because if you can remember the skill of risk management is actually written here as well. And 90% of these Australians, or the population in Australia, actually would involve this risk. Another reason is because we as registered nurses, we do not prescribe, but we administer these medications. The prescription and the dispensing comes first. The administration comes last. It doesn't mean that we are the only ones accountable, because everybody in the healthcare system who has done the prescription and the dispensing of the medication is also accountable for releasing a wrong medication, for example. But the administration, which is us, is the very crucial part because it involves the life of the patient. When a doctor prescribes, a pharmacist dispense, there is no life involved. But when you administer, there is a life involved, and it could be from mild reaction or to death, which is very very challenging for nurses, because we are the ones that is the last in line for medication administration, but we're always the first in line as well when it comes to accountability. So these are the very few reasons why we have to know, and we now understand the reason why NMBA, the Nursing and Midwifery Board of Australia, actually has included medication safety in your OSCE. So they want you to be ready, making sure that you're a safe practitioner to look after the Australian community. And when I say Australian community, we are a very multicultural country in Australia. And I am referring to all the people in Australia that seek for the healthcare service. So these are the concepts of medication administration. And as an overseas registered nurse, I would presume that you do not know 100% of these concepts. And that is the reason why Nursing Education and Training Australia is here to guide you, because we in NETA, we do have our educators that are very experienced, and they do have qualifications both overseas and Australia that actually can teach you and understand your learning. What are the things that you need to unlearn in your home country and you need to learn as a new technique, new standard, and new practice in Australia? So the first concept is quality use of medicines. And when we talk about quality use of medicines, we are talking about when to use a medication. In the Philippines, where I am trained and where I was trained, we as registered nurses actually may have a little bit of a say, or nothing at all, no say at all when it comes to a prescription of a medicine. So if the doctor, for example, prescribes amoxicillin, which is an antibiotics, we know for a fact that amoxicillin has been there for ages. And there are a lot of patients already that are actually resistant to it already. So if you know that a patient is resistant to amoxicillin, but it is being charted by the doctor in the Philippines. I do not have a say for that. The doctor has charted, I am going to give it. In Australia, we do have a say, and it is expected for us to actually ask and question that prescription. So the quality use of medicines is to make sure that the patient is actually prescribed with the right medication. And we're actually administering a correct medication that is appropriate for the patient. So this means that in OSCE, if a patient has, say, a methicillin resistant Staphylococcus aureus, which is MRSA, if the doctor has prescribed a methicillin based antibiotics, what do you do? So that is a reflection from your end, and this could come out in OSCE. This could be something that you need to think of. What are you going to do in that sense? And your communication skills will be tested here. How are you going to approach the doctor? How are you going to address the issue to the doctor, where there will be a therapeutic, professional relationship between you and the doctor, but you are questioning that medication? So that could come out in OSCE. And there could be other situations, other scenarios as well that would talk about the quality use of medicines, or that would tackle this concept. The next concept is high risk medicines. And we say there is an abbreviation, which is APINCH S, and this is something new to the Australian, to the overseas or the international qualified nurses. The reason is because we do know that there are different high risk medications, but the national standards in Australia has actually classified them as APINCHS. I cannot discuss this in details, but A is an anti-infective, and this includes all medications that treats infection, not just bacteria. So you know that there are 5 classifications, and this could also include virus, fungi, helminths, protozoas. So the letter P is potassium and other electrolytes. I is insulin. And I want you to actually research more on this, because if you have done your NCLEX, you should have a knowledge about APINCH as well. N would be narcotics, C would be chemotherapy agents, H is heparin and other anticoagulants, and S would be systems. And this is where we come in place. What are the systems that are put in place in Australian healthcare facility to be able to maintain the safety of patients receiving high risk medicines? For anti-infectives, what are the standards that are put in place for administering piperacillin tazobactam, for example, we call tazazine, which is a brand name in Australia? For potassium, what are the principles behind administering potassium and other electrolytes as well? What are the things that you need to prepare when you are actually administering this? How many nurses can check? Who are these nurses who can check? So that's the thing. These are the things that we will be discussing in your classes in OSCE. The next one is insulin. What are the guidelines in administering insulin? When do you give what type of insulin? And you have your narcotics. Narcotics is very common in Australia, not very common back home. I probably would have administered morphine, and I administered it by myself without anyone checking it. In Australia, there are certain scope and practices when you administer narcotics. And this is something new, something that you need to unlearn back home, because we just administer. We call them S2 back home, Schedule 2 back home. In Australia, we call them Schedule 8. And this is again another concept, the schedules of medicine, which we'll be discussing in a while. Then we have letter C, which is chemotherapy. So the chemotherapeutic agents. What are the guidelines that is behind the chemotherapeutic agents? As an entry-level registered nurse, if you're looking after patients on chemotherapy, what are the things that you need to consider? What color of PPE would you be wearing, and what are the PPEs that you'll be wearing? Now, these could come out in OSCE, and it could be you're looking after a patient with who's under chemotherapy and suddenly becomes unconscious. What do you do? So it's not only about assessing the patient for unconsciousness, but also what do you do as a preventive factor, or as looking for the danger. What are the things that you need to do before actually going to the patient? Then we have heparin and other anticoagulants. What are the therapeutic guidelines when it comes to administering heparin or other anticoagulants? What are the um, what are the guidelines when you actually administer warfarin, for example? Or are there any therapeutic levels that you need to check prior to administration? I can remember when I was back home, I just administer them as they are ordered. In Australia, we need to check every bits and pieces, and these are the new things that we need to learn. INR levels, for example, PT, for example, prothrombin time, APTT, for example, and in which medications do we do this? What are the certain protocols? How much meal per hour do we have to increase if the APTT of a patient on heparin infusion probably increases to 120? So these are the things that we need to learn as well in OSCE. The next one is medication chart, and this is quite complicated but very common. This is something that we use across Australia. We do have a standardized medication chart. We call it the National Inpatient Medication Chart, and this National Inpatient Medication Chart, or we call NIMC, all registered nurses should be familiar on how to use this and how to document. It looks very complicated when you look at it, and this is what our students say. It looks very complicated to us, and it's very good that we are able to actually let them have the hands-on experience of documenting in this chart. So what are the parts of these charts? And the medication chart itself, when I do this session, is actually a 2-hour session. So that's how complex it is. And it is very important for you to know when you take your OSCE, because you will be using it. Then we do have another concept, which is medication reconciliation. And this is a very new term for everybody, I would say. And I do not remember that this is practiced back home in the Philippines. I'm not sure with any other countries, but in the Philippines, where I am trained, or I was trained, it wasn't practiced. Medication reconciliation would mean that the patient must be prescribed with a medication that it must have. So, say for example, a patient coming for surgery for appendicitis, we call it appendicectomy in Australia, appendectomy in other countries. So, this patient who has appendicectomy, for example, came in and is charted with antibiotics and pain relief. That's beautiful. When it comes to medication reconciliation, it is our responsibility as healthcare practitioners to actually review the patient's medication chart. Is the patient charted with the right medication? Probably yes for antibiotics, and probably yes for pain relief. But what if that patient has a history of high lipids, for example, and is on atorvastatin? Has atorvastatin been charted? What if this patient is diabetic? Are the hypoglycemic agents or medications charted? And in most cases, this will be missed by the doctors and by the nurses, because we are so focused on the history of present illness. What are they coming in for? And we are treating that. But we forget to see the patient as a whole with complex chronic medical conditions. And this is part of medication reconciliation. It also happens where there is a transfer of care for this patient from surgery to ICU, ICU to the ward as well. So it is very important for all healthcare practitioners to make sure that there is medication reconciliation of patients. And this is the reason why it's part of the medication safety. Sounds new to you? We are here, and that is the reason why we're here to teach you all of this, because we really do not want you to fail in your OSCE. We want you to become registered nurses, and that's in a positive way, because we are in dire need of nurses, specifically in the rural, remote areas, and of course during this pandemic, you are needed in Australia. All right, another concept is a safer naming and labeling and packaging of medicines. So, this is where the National Tollman lettering comes in. Sounds very new to you, I know. It was very new to me when I first practiced in Australia, and this was actually implemented in 2012. So, very new to me when I practiced in Australia because this was implemented by the time that I was already practicing. So the National Tollman lettering is a safety precautions for look-alike, sound-alike medications, and this could be as simple as hydromorphone and morphine. So why it is very important? Morphine and hydromorphone sounds the same, and there has been a couple of incidences already in Australia where a nurse has administered hydromorphone instead of morphine. Why is that very critical? Because hydromorphone is 5 times more potent than morphine. So if the order is 5 milligrams of morphine to be administered intramuscular route, that means if you have given hydromorphone, you're actually giving as likely as a 25 milligrams of morphine, which is very dangerous. This is a very high dose that can actually lead to death of a patient. Then we have the user applied labeling of injectable medications. This was part of a demo class. I'm happy for you to review this and happy for you to actually check our YouTube video when it comes to the user applied labeling of injectable medications. I just wanted to remind everyone though that whatever is in the demo class is a demo class, and this does not cover the whole concept of everything. So you are invited to join our sessions in NETA if you would like to seek the detailed information, because we have put this in our program in a way that is very extensive, and it takes a lot of time to actually explain and learn and teach these concepts. So yes, whatever is in the demo class would only be a part of what is the whole picture of it. So, yes, please review the user applied labeling of injectable medications if you'd like to learn more about that. This is something new. I know that we do label back home where we are trained, but we have a standard in labeling. We did not have. For as long as it's labeled, for as long as we know that that's a medication, then we are safe. Definitely. But in Australia, there is a certain practice where we use color coding, where we used different sizes, and where we used different information to actually put into our medication for us to make sure that we have labeled these medications safely. There has been few incidents where an oral paracetamol has been put into a IV syringe, and this nurse has left this medication because of an emergency. And here comes a nurse with with no intention of harm, and the intention is to help the team, saw that medication and was actually about to administer paracetamol oral intravenously. And that is the reason why it is very important to label this medication. This is just one of the very many incidences, and it's not just in Australia. It happens across the world, and that is the reason that when you practice in Australia, there are certain standards that we need to utilize. The next one is the heaviest concept, which is medication administration. So this deals with the 5 rights of medication administration, and I know that everyone would probably know already about the rights of medication administration. That is very good. How do you implement that in an Australian healthcare facility? That is the next question, and this is what we teach you in OSCE. Medication calculation, this is universal, something that you would already know. This is something that I would also say that does not need help in the preparation. So if it's only medication calculation for OSCE, definitely you don't need a preparation, because this is something that everybody should know as a registered nurse. Then we've got the accepted medication abbreviation, and this is part of the national standards. there could be situations, scenarios in your OSCE where the inappropriate abbreviation is used. Do you have to question this? Yes. Have you questioned it, or do you question, or do you know how? Do you know which one to question? Is the first question. Do you know which abbreviation do you need to question? And in that case, how do you question? So this is something that you need to learn as well in your OSCE preparation. And then we do have the scope of medication administration. Who can administer? Back home in the Philippines, where I used to practice, registered nurses administer the medications. In Australia, we do have enrolled nurses. We do have nurse practitioners as well. We do have assistant in nursing that actually has the medication competency, that are also able to administer medications. But what is their scope? And for ENs, what is the scope of the EN? There could be some delegation in your OSCE. Can you delegate it to the EN or the enrolled nurse? Can you delegate it to the AIN or the assistant in nurse? Is this something that you need another check? And who can check? Can a midwife check with you? Can an enrolled nurse check with you? Can another registered nurse check with you? So very broad, but these are the things that we will be covering in your OSCE. And lastly, schedules of medicine. So in Australia, the medications are classified into different schedules, and in different schedules, there are different interventions and different scope as well of registered nurses. So say, for example, we talk about schedule 4 medications, which is the prescription medicines. And these prescription medicines, what are your rights as a registered nurse? What could be your rights in administering this medication? When I talk about the right, it talks about your own scope. What about your responsibility? How do you administer this medication? What are you accountable for? Are you accountable in administering a medication, which is an S4? So say, for example, antibiotics. What is your accountability when you administer these antibiotics? We talk about scope. Do you need to check this with another nurse? Is another responsibility that you have, or accountability. We do have another example, which is an S8. An S8 is a schedule, the Schedule 8 medicines or the drugs of addiction. What are your scope when you administer this? And what are the things that you need to consider prior to administering, during administration, and after administration of these medicines? We do have S4D, which is the S4 restricted medications. And these medications also have a different scope and different guidelines in the administration. So it's quite complex. There are 8 schedules of medicines. And as I said, it is something that we need to discuss and teach you in details. So these are all the concepts that a registered nurse must know when it comes to Standard 4 of the national standards. And I know that it is a very broad and complex concept. And that is the reason why we're here, to be able to share our knowledge, our experience, and to be able to teach you with the skills that goes with these concepts. So our OSCE is a 2 weeks of online class and 5 full days of hands-on training. We do have a combination of the online class, face-to-face training, your portal, the workbook, and a lot of resources. These resources are either electronic, which can be located in the learner's portal. These resources can be physical resources, which is also in our library. We do have the books that are recommended by the NMBA, and also these resources can be subscription, which we can give you the access to. So an example would be the Australian Injectable Drugs Handbook. This is a subscription that our NATA students can have for you to be able to familiarize common medications that are used in Australia. And these are injectable medications. All of these resources are accessible for you within the next 6 months. And for offshore students, you will have continuous access, and the 6 months access will start once the border opens. So, for more information, we will be very glad to answer your questions and we will be looking forward to a conversation with you. Our office is located in Wagga Wagga, in Sydney, and in Melbourne. And wherever you are, we would like to invite you to give us a call or send us an email. Or if you have Facebook, please send us a messenger in Neta OBA or NETA OBA Facebook so that we can chat with you and answer your questions. And also, if you would like to know more about the preparation, please feel free to give us a call. I would answer some questions if there are any questions. If there are no questions, I'm happy to finish the information session. Thank you very much, everyone, for listening. I'll just stop the recording now.